New daily persistent headache is a headache that occurs, in medical terms we say de novo, but sort of out of the blue. It starts usually at a specific time the patient can identify, and once it comes, it just doesn't go away. It often occurs in young adults, usually young women more than young men, and we don't really know why that happens. And typically, we'll see some type of infection that sort of precipitated it, but the infection goes away and they still have the headache. It's just there all the time.
I don't remember the last time it was gone. It was always there. I saw my pediatrician and she told me to take Advil and that didn't work.
Part of the anxiety and difficulty patients have is that they don't understand what's going on, and people take an MRI or do blood work and say, oh, everything's fine, you're fine. Yeah, doc, but I got this headache every day and it's not going away and it's a number 8 and I can't function. So I think number 1 is putting a name on it and then having an appropriate treatment plan.
It used to hurt really bad, and on a scale of 1 to 10, like an 8. Sometimes it would get higher, but it would never get really lower than a 7 or a 6. Now that I came here, it's now usually a 1 or a 2.
Well, we're very successful in treating it. Obviously, sometimes what we'd like to do if we catch somebody early on is really try to break the cycle. So sometimes we can use some steroid, sometimes we'll use some intravenous DHE depending on the characteristic of the headaches. The thing that nobody really has the answer to is that once the headache is controlled, how long does somebody with new daily persistent headache have to be on therapy? And so what we'll try to do once people are better is wean that medicine away and see how they do without it.
Before I came here, it was like in the front of my mind and I can never really push it away. It hurts so bad. Now it's like really calm and it's almost just like a memory, like a far back memory. It's like right now it's like a 1 and it doesn't hurt very much, and I can focus more on my activities and schoolwork.
That's the most important thing, is to get patients back to living their lives. And like other chronic disorders, yes, I have this, but my life is normal and I can do the things I want to do every day.